Yes, Greg J, how are you today? Hope you are doing okay. Checking our systems, trying to remix this, but get this information to you. Most Ricky Tick. How's things going for you today? Sorry about the technical difficulties. It's okay. We're just moving stuff around and just trying to, get a little better. Got to make some hardware changes here, adapting and overcoming. This technology thing is something, isn't it? We're doing, we know we're on the leading edge of technology, and we know we're giving you the best that we can, through the available technology. And, sometimes things happen. Equipment gets a little awry, gets a little temperamental, but we still want to be on point and bring you the information. But earlier today, when we came in, we just gave you a few headlines. Again, we extend our condolences to the families of those who concert goers who lost their lives in the Astral World Festival down there in Houston, Texas. Man, what a tragedy. And we were sharing with you that uh, we are experienced festival producers, and we want to reach out to our friends here to talk about what happened in that time and how do festivals prepare for disasters? How can they mitigate such tragedy? How can they mitigate the potential for tragedy? I mean, man, this was really, really something. 8 people died. There's a lot of things swirling around in the universe as to how it happened. Some got squashed to death. There's even rumors of something they're calling needle spiking. So somebody running around jabbing people with drugs, and I mean, it's just a lot to consider. Redistricting is going on all across the country, no doubt. Certainly all across our state, and right here in the city of Long Beach, where Coffee Conversations with Greg J and Beach City Radio, Kalimba Song Coffee Company, all of our platforms originates here in Long Beach, and it's a hot topic. I was sharing that I thought redistricting was connected to the census, and I feel like the census was not complete. It probably was. I guess if we give them the benefit of the doubt, well, all I know is the pandemic happened. That's what I know. And I was there when they shut everything down, right in the middle at a census meeting, and they shut everything down. So I don't know. We're going to find out how that works, what's supposed to happen in the process, and maybe even a separate show will have some community folks, some activists, some academics to come through to talk about their observations, their contemplations on this whole redistricting. The NAACP's got me up there, man. Real Men Wear Pink. You can go on Coffee Conversations with Greg J platform. Go on Beach City Radio. Check that out. If you want to make a donation towards breast cancer research in my name, I would definitely appreciate it. And maybe before the show is over, we'll be able to give you some information on how to do that if you want to support our advocacy for breast cancer research. In the meantime, California and I think even across the nation, they've approved vaccinations for children 5 to 11. And so yesterday we were joining with the California Black Media Network, of which we are a member, and the executive director, Regina Wilson, convened a press conference of Black media from all over the state of California to listen to the California Secretary of Health and Human Services, Dr. Mark Ghalfy. I think that's how you say his name. And you say he's giving us the information on how and what and where to get your children vaccinated if that's what you choose to do. I know that it is a point of conversation in our communities because you know what? I'm looking across our immediate region. I see there's cities over in Inglewood. They had some COVID cases come up, and the school wasn't quite prepared to test the students or react to the outbreak on campus. Parents are in an uproar. Community and officials are in an uproar. And there was one even senior official that said they were not prepared. They didn't have the manpower to conduct daily testing, to conduct regular testing of the students as they come to school. So there's a lot to consider if you're sending children to school. Your little ones are going to school, and we're opening up. We're coming back into this spirit of recovery, and we want to know, are our babies safe? So is vaccination the answer? I'm not here to tell you what to do, but it sure seems like it might be the right thing to do. It's up to you, though. Get the right information, and that's what we're here for, to give you the information, man, so that you can make your sound decisions about your health and well-being in these days and time. All right, well, without further conversation, let's get right to it. This is a press conference took place yesterday, actually yesterday afternoon. Condolences to Snoop Dogg. Snoop Dogg lost his mom at the funeral yesterday. I was in attendance there, and great woman of God. If you remember, if you follow us, you'll know that Rhonda Love and I honored Evangelist Beverly Broaddus Green at the Michelle Obama Library. She got one of our acknowledgments of celebrating excellence. Great woman of God, great woman of the community, and she's gone on to the next level, transitioned, gone on to be with the Lord. And may she rest in peace. All right, let's get to it. This is the press conference took place yesterday. Let's hit it.
Systems ago. All right, well, thank you so much. My name is Regina Brown Wilson. I'm the Executive Director of California Black Media, and I'll be your moderator for today's briefing. Thank you, everyone, for joining us today. I want to thank our special guest speaker, Secretary of California Health and Human Service Agency, Dr. Mark Ghalfy, and to all the media joining us today. As you know, this conversation couldn't come at a more important time as the state continues to roll out COVID-19 vaccines for ages 5 to 11 after the FDA, the CDC, and the Western States Scientific Advisory Group gave the green light last week. Today's conversation will focus on safety, effectiveness, and the need for the COVID-19 vaccine for children 5 to 11. The state understands that this is not a one-size-fits-all approach when addressing healthcare concerns, and hopes today to be able to answer questions that you might have for your constituents, your listeners, your readers, and your viewers. This briefing today is in collaboration between ethnic media organizations across California and the Vaccinate for All 58 campaign. Your work as journalists is critical in getting the word out to the vaccinate about vaccinations to our community and to the more than 438,000 API children, the 171,000 Black African American children, and the over 1.7 million Latino children aged 5 to 11 in our state. So just for house rules, we've collected some questions from media ahead of time. So those will be questions that'll be in the queue first. And then we're asking that any speaker speak slowly because this will also be simulcast in Spanish, Korean, and Mandarin. I now want to give the honor to Dr. Ghalfy and allow him to address our briefing.
Fantastic. Regina, thank you for your graciousness in hosting this. And to all of the folks from the media, it's a pleasure to be with you. I know I've had a chance to spend time with many of you previously, but not in this forum. And for me, this is a critical opportunity to make sure that in language, in culture opportunities we get a chance to speak to all Californians. So very, very much thank you for taking your time to be with me today. Regina, building off what you started, it is exciting to close out this first week where we've had the permission from the FDA and CDC, the clearance to begin providing vaccines to 5 to 11-year-old Californians. We've received hundreds of thousands of doses already in California. We anticipate getting by the end of the second full week, almost 1.8 million doses of the 5 to 11 approved vaccination. I want to take a moment and just thank all the providers in our community, 500 strong, growing to 4,000 eventual providers who are going to be in a position to provide pediatric, that 5 to 11 vaccination to young people. These are the big health systems, Kaiser's, Dignity, your local federally qualified health centers, many of the places where our communities receive care, the pharmacies preparing to provide these doses to young people. It's really exciting to see this begin to take shape as we've prepared long and hard for this moment. I can also tell you that it's only come after months and months of the availability of the data, trials that included over 4,000 young children, 5 to 11, to make sure what is now a lower dose. So the adult dose of Pfizer is 0.3. The pediatric 5 to 11 dose is 0.1. So it's a third of the dose that adults are receiving, a third of the dose that even our adolescents 12 and older are receiving. So it's a lower dose, a different formulation, and it's available specifically for this 5 to 11 population. The studies that were done, the trials that were done to make sure that this vaccine is safe and effective at this dose were robust. They came together in rapid fashion in order to address this important pandemic, recognizing that vaccines are the way through the pandemic and allowing us to get 5 to 11-year-old Californians. They represent 9% of our entire population. Regina, you mentioned some of the different population sizes of our different groups, whether it's young Black children or Latino children or Asian Pacific Islander children. We know that we have quite a few 5 to 11-year-olds, like I said, 9% of our entire state now has a chance to get the same protection that so many older Californians have had for many, many months, that have protected them and kept our communities safe. I often get asked, and I'll just go to this issue right away and then turn it back to you, Regina, to take a number of questions is, well, as a pediatrician, as a father of 4, what do I think? What am I doing? What am I talking to people in my own community about? And first off, I will tell you, 3 of my kids are under the age of 12. Not a single person in my household is without their first dose at least. Most of us, half of us are fully vaccinated. The other half are getting fully vaccinated and have received their first shot in the 2-shot series. And then also, when I think about what we're doing this for, I'll remind you that we've had hundreds of thousands of cases among young people. 60,000 young people, 5 to 11, have been hospitalized in our nation. And we've lost more kids to COVID than we do to other vaccine preventable diseases in our nation. In California, we've lost over 30 young people to COVID, and any additional death of a young person is unacceptable if it's preventable. So we must use this tool to not just protect our communities. We often talk about how getting young people vaccinated is going to help protect our families, our older Californians, but I often focus now on how important this protection is for our young people themselves. Long COVID, the long-term complications of having a COVID infection are real for young people. We're learning more and more about these every day, every week, every month. And so if we have a chance to prevent an infection in this 5 to 11-year-old category with the vaccine, then we're excited to continue to encourage people, caregivers, and young people to go ahead and get vaccinated as soon as they can. So with that, Regina, I'll turn it back to you to take a series of questions.
Okay, well, thank you so much for that. And I do want to open this up so that we can start asking questions. And I will start with, you answered one of the first questions that I think someone already had sent in, and that was on the dosage size. So let's move to one of the second questions. Should kids get the flu shot at the same time they receive their COVID-19 vaccine?
Yeah, they certainly can. There's no reason that they can't, and a lot of practices are encouraging folks to get them together. What we expect, not different from other vaccines that young people get. They might have some soreness in their arm. They might have some low-grade symptoms. Some people might get a low-grade fever with vaccines. But these are not reasons to not get the vaccination altogether. So we're encouraging people, work with your pediatricians, work with your family practitioners, your family doctors, ask your questions. And if you can, and we believe it's safe, go ahead and get both your flu shot and your COVID vaccine together.
Okay. So you answered a little bit about the side effects. That was another question. What would those side effects look like? And you actually, I don't know that you have to expand on that. I think you probably really did. There's another one. How can parents feel reassured that COVID-19 vaccine is safe for kids of all backgrounds?
It's a great and important question, and I've already sort of outlined. We have a large national study that looked at 5 to 11-year-olds, and they're very good at making sure that it's a representative population. And so making sure that we have young people from all regions of the state or the nation, all races and ethnicities, young people with pre-existing conditions, as well as young people without, to make sure that it's a representative sample. That all said, I always encourage, as a pediatrician myself, that parents and families go ahead and connect with their trusted clinical provider, whether that's their family doctor or pediatrician, whether that's another source of important health information, to get the questions answered, so that you can go in to getting your young person vaccinated with a great deal of confidence and reassurance that this is the right thing to do. I can share with you all of the data in the world. We can give you all of the information that I think is convincing and important, but that trusted individual that you turn to, I think, is going to be a really important person to help you ultimately feel confident and make the decision.
Okay, this is a question, I believe, from Henrietta Burrows, East Palo Alto today. How do you or will you suggest to convince those parents or families whose religious beliefs are in opposition to the vaccine for them and their children?
This is again another difficult one. We've made a lot of inroads, but I will say that if you have a religious belief against the COVID vaccine, I do wonder if those same beliefs uphold with other vaccines. If you're a caregiver to a child who's received other vaccines for school or for other illnesses that we know we can prevent with vaccinations, I'd ask, how is this one different? Why suddenly are we concerned about the COVID vaccine in a different way? And those are conversations that we really urge people to have, talk to their faith communities so that they can come back with accurate information, a complete picture to help make the determination. The other thing I would say is we often talk about the COVID vaccine as opposed to having no intervention or having nothing else happen. The truth is we're talking about protecting young people and all Californians with COVID vaccine versus allowing people to get infected. And we know that even if you don't have the worst consequence of hospitalization or dying from COVID, that there still are long-term repercussions that we're learning about. So my hope is that we always think about the global protection that we're hoping to provide young people, that it is not without risk to go unvaccinated. In fact, we are feeling more and more confident that if you aren't vaccinated or protected, you will eventually be infected with COVID because it is such a transmissible and a transmissible virus that is really all around our community at different times during the year, but one that we're all very worried about increasing in numbers and volume in our community as we enter the winter.
Thank you so much for that. And I stand corrected. That question, I believe, did not come from Henrietta Burroughs. It came from a different reporter, but I'm getting some of the questions in different orders. So please forgive me. I will just ask the question and not say who it's coming from. Will children require boosters eventually?
So we don't know. I'll tell you, because of how the pandemic is evolving with new variants and the concern for even more transmissible versions of the COVID-19 virus, that we may at some point be required to get a booster shot for kids 5 to 11 or those who are 12 and older. Right now, we are feeling very confident about the level of protection over the next many, many months for young people to get their 2-shot series with the 0.1 dose. But just as we have done for older recipients of the vaccine, there'll be ongoing investigation and studies to make sure that that strength of immunity that we depend on to prevent getting an infection or a severe infection is provided to young people, and down the road that may require an additional dose.
This question is, are you planning to host vaccination sites? Not you personally, I guess. I guess you'll be there though, at some of the sites, at schools, particularly Title I schools, to get more young people vaccinated?
Yeah, it's a great question, and been something we've been planning in partnership with our healthcare partners, our local health jurisdiction partners, and frankly, schools across the state. And soon, probably a week out from now, the middle of the month, we should see many more vaccination sites connected to schools, but not just for students, but for students and their families, for the community at large, to support Californians who should be getting a booster. And I'll frankly tell you that I think most Californians who are interested in getting a booster should go ahead and get one soon, that those will be up and running and available. And in fact, later this afternoon, I'll have the privilege of attending one of those early school site vaccination clinics here in Los Angeles County, where I am today.
Okay, great. Who are the people who let their kids get involved in the trial?
So it's a number of different people. A lot of folks were outreached through health systems and their primary care providers across all of the different states. And frankly, they usually have, and we have seen this with COVID vaccine trials since the beginning, we usually have many more people interested in getting into the trial than actually do. So there's usually long wait lists, and they're reached out through general reach outs through providers. So for example, I know I received an invitation through my provider to enroll my own children in a vaccine trial. They weren't invited to be part of the trial because they have so many young people who signed up, but they try to have this make sure that it's representative, like I said before, regionally across the states, as well as based on race, ethnicity, age, gender, and other characteristics. So that's how they essentially set up the trials.
Okay. How much are children age 5 to 11 currently contributing to the spread of COVID in the US?
Yeah,
And I guess California,
yeah.
really.
Well, great question. And the truth is increasingly so. As more older Californians and adults became vaccinated, the group that was most susceptible to infection were young people. So we've seen in some cases that the under 18 have represented sometimes 25% of the state's cases, and certainly across the nation, we've seen even higher percentages. So the idea that young people don't get infected and don't get affected by COVID is not true. And in fact, they're one of the increasingly most impacted groups in our own state here in California.
Okay, and this one is from Jonathan Linden. Sorry, Jonathan Linden, the Round Room Live. He said he's attended anti-mandate rallies here in the Inland Empire. One of the leaders is a nurse and expressed major concerns over, I'm going to butcher the
Myocarditis, yeah.
Myocarditis. What is your response to that? And what is your response to people who say we're all a part of an experiment that we don't know the long-term effects of the vaccine?
Well, so on the first point, I think we obviously have to take very seriously and take care of the information, the data, and the attention to side effects from not just this vaccine, but any medication or any therapeutic. So it's not something that we take lightly. I think there's been a number of cases that have been examined, exposed. Thankfully, the vast majority of young people have no significant side effects from the vaccines. Very few, on the order of a few in the millions actually get any significant side effect. And then the other good news is even when those do occur, they often resolve with minimal intervention or self-resolve. So that is the good news. In the 5 to 11-year-old group, even though the size of the trial group was only about 4,000, they didn't see any cases of myocarditis or pericarditis. That said, they have seen it in older teenagers, and so we take that very seriously. The one important feature is that the 5 to 11-year-old have a lower dose, which we're going to learn over time, may contribute to the fact that we're not seeing cases of myocarditis or pericarditis in that age group. The last thing I would say on this, and it's sort of the theme that I mentioned before, young people who get infected often have many more significant outcomes than those who get vaccinated. So when young people get infected with COVID-19, we have seen long-term complications of the inflammatory response, whether it's on your cardiovascular system, your endocrine system, or your neurologic system. I think we've seen some cases of influenced or impacted neurologic problems for young people, some psychiatric problems. We've had plenty of young people admitted to the hospital for respiratory problems as a result of COVID. So it's often we have to look at what are the consequences of the vaccine, but not compare it to nothing happening, but the fact that many young people who get infected do have a negative outcome and have some problem for weeks, months, and we hope not years down the road after getting infected by COVID.
So next question is, so many of the communities our media represent do not have regular pediatrician or consistent access to health care. How is the state planning to disseminate information to people who have little to no access to health care?
Well, so we continue to use outlets like this one to make sure that the message gets into the deepest parts of communities that often aren't connected to mainstream media or mainstream California media. So we're hoping to continue to use those avenues. And then secondly, continuing to use our trusted community partners. We have forged partners throughout the entire pandemic response with hundreds, thousands of community groups in almost every part of California in partnership with local health jurisdictions to ensure that we get community communications through those trusted messengers, our faith-based partners throughout California, schools, another source of trusted messengers, as well as increasingly working with employers that have access to employees who take those messages to heart and take them home in their communities. So all of that is going to be ongoing, and then there'll be additional investments in language media through some paid advertisements, both on the 5 to 11 vaccine, as well as ensuring that Californians who are due for a booster and feel they could be protected from an additional vaccination know how to go about getting that vaccine as soon as possible.
Right. Are there myths regarding effect of the vaccine on 5 through 11 kids we need to make sure to address and debunk? And this is asked by Sherry Moreno, Philippine News.
Yeah, I think it's a few points on that, and we've addressed some of this already. But there's often conversation and concern about the impact of the vaccine on people's fertility, and I hear this more and more coming up on even young people 5 to 11. Will it impact their fertility? And to date, and this has been looked at with a great deal of attention, there has been no connections to fertility issues for adults, either men or women, or young people as well. So that's one important myth that I think is important to debunk, to make sure that we share the information from a number of different trade associations, including the American College of Gynecologists and obstetricians, who have themselves put information out on the safety of getting the vaccine. And then secondly, we've already dealt with and talked a bit about the impact on myocarditis and pericarditis, that we seldom see these important reactions occur as a result of the vaccine. And when we do, they are often resolving themselves without significant intervention. But most importantly, that the risk of having more serious cardiac consequences from getting infected are real and well documented for young people. So those are two very important ones. The third one is, and I think that this was another question, Regina, that you asked that I failed to answer, which is what do we think about, how do I respond to, this is one big experiment that's, inviting every Californian to be part of it. The truth is, we've lost 72,000 Californians to COVID. We have been looking for a miracle, for solutions to help us get through this pandemic. The vaccine represents the best form of that ability to address this, help us get through what has been a very challenging nearly 2 years, has claimed way too many Californians' lives, their livelihood, because of the concerns and fears and threats of COVID to our communities. Our economy has gone through quite a bit and has come out very, very strong. So getting more Californians vaccinated is our way through this. Again, the theories and ideas out in communities, hard to deal with them, every last one of them. But certainly, I think the overarching point that I turn to is these have been some of the most safe, some of the most effective, and some of the most successful vaccines we've ever seen in modern medicine. And being able to deliver those successfully to all Californians is something we will continue to work hard with all of you to do well.
Well, I want to make sure, I know that we have only a couple more minutes. So Fatima, I think that has the last two questions, and I'm going to try to combine them with the Arab American Press Guild. So over the next 6 to 12 months, how many young children does the government project to successfully vaccinate? So that's one question. And what numbers in your eyes would look like, what would look like success? And then there's one last one that is, what happens if we can't convince skeptical parents to vaccinate their children?
So we have 3.2 roughly million 5 to 11-year-olds in our state. Success to me is getting as many of those vaccinated, those young people vaccinated as possible. Because usually if you're willing to vaccinate your young person, you're willing to get vaccinated yourself. So that means we're making great success at getting adults and young people, all eligible Californians, to become vaccinated. I have shied away from setting specific goals because I'll always want us to do as well as we can. You've heard goals of 2/3, 75% of Californians getting vaccinated will be success. We know that that is a good number to start, but we want to knock on the door of 85%, so that we make sure no matter what COVID throws our direction, whether it's a new variant or people who can still get infected despite having had the vaccine because it's been many, many months, we want to make sure that we're doing all we can to wrap a thick blanket of protection around our state. And to the question about what we'll do if we can't get Californians vaccinated, I mean, we are working hard all the time to make sure our healthcare delivery system can take care of people who become infected and have bad consequences from COVID, other respiratory illnesses, and other health issues that take you into the hospital. So we will continue to make sure and work hard to prepare those systems to take care of as many Californians that need care as possible. But as we saw over the winter last winter, we can't afford to get our guard down, have our guard come down. We must continue to support those hospital systems, to do what we can in communities, and that starts with getting ourselves and our families vaccinated as quickly as possible, so we don't see people having bad health consequences because the healthcare delivery system is overwhelmed and can't take care of all Californians that need it. So we're going to do what we can to deliver a strong message on why getting vaccinated is important, deal with all of the counter messages to vaccinations as much as we possibly can, lean heavily on all of you to help us get that message out, ask us the tough questions, challenge our assumptions so we can do the best we can for all of our communities, while also making sure our healthcare delivery system is strong and prepared for whatever gets thrown our way.
Well, thank you so much, Dr. Ghalfy, for lending your knowledge and taking questions, and actually taking questions that were not scripted for you. I just want to make sure that everybody knows that, because I appreciate all and respect all the journalists up here who come to ask the questions that are tough, the questions that they know that they're going to get hit with their community. And I know that we have to do more of this, because I know that this just happened last week. And so it's going to, they're going to be getting more questions of things that are going to come up. So thank you for taking the time. We look forward to having another briefing with you at some time in the future. And I want everybody else to know, be on the lookout for other regional community conversations around 5 to 11 COVID-19 vaccines coming later this month, and that will come from the Vaccinate All 58 campaign. So with that, I will let everybody have back the rest of their day, and thank you so much again for joining us this morning.
Thank you, everyone.
Yeah, well, there you have it. California Black Media Network Executive Director Regina Wilson moderating a press conference with the California Secretary of Health and Human Services, the Health and Human Services Agency. So I suppose that's the organization that is in charge of getting the vaccine to the public and making sure that that occurs. I'm sure that they are also working hand in hand with your local health officials. So, we just try to give you the information. We have access. We're sharing with you, the beloved community. And with that, Thursday is Veterans Day. We hope to do a little special something about military history. Tomorrow, Wednesday, November 10th, is the Marine Corps birthday. Hurrah, Semper Fi to all of you devil dogs out there. And you know what it is. November 10th is on, right? Yeah, it's good stuff. Then Veterans Day on Thursday. I was looking and they just laid to rest Colin Powell, right? General Colin Powell. And I began to look across military history to the Black generals, and there's not been many. And we'll talk about that on Thursday, but if you look at Colin Powell, I remember when I was in the Marine Corps, it was Lieutenant General Frank Peterson. He was the man in the Marine Corps. And, there's never been an African-American commandant of the Marine Corps. Right now, the Chief General of the Air Force is a Black man. I'm not sure about the Navy and other, other branches of the armed forces, but I know that we've been up there high, even Black women, Admiral Michelle Howard. Wow, what a real, sailor, Navy, straight Navy. All right, enough jibber jabbering today. Make it your best day, and always remember, Coffee Conversations is on beachcityradio.com. The audio will be repurposed across all podcast networks. You can see it there. Just check it out. Coffee Conversations with Greg J. All right, got to get back to it. Love one another. Love one another. Love one another. Peace and blessings.